Do you have chronic neck pain and headaches and mental fog and vertigo, and you recently went to a bunch of healthcare practitioners and someone took an x-ray on you and your neck came out looking just like that and they told you have military neck? They probably didn't tell you much after that. What I want to talk about is how all the symptoms I just mentioned can be coming from your neck and why your neck curve gets flattened and it should be like this. Why does it get straight? So it's a matter of muscle tone regulation. There's muscles on the side of the neck here. There's a group of them on both sides called the scalene muscles. And when you have an injury to the upper neck, whether that's a whiplash car accident, a slip and fall, a sports injury, there's a lot of different blunt type trauma that can happen. This is the top vertebra that sits right there. That's the atlas. Your head weighs 10 to 12 pounds. It sits on this top vertebra. And when you have a blunt type whiplash trauma, because the head is 10 to 12 pounds and it sits on this 2-ounce bone and it gets whipped on the neck, that vertebra can dislodge and lock out of its normal biomechanical range. And when that happens, it affects the central nervous system and these scalene muscles become tight and it draws the head forward. Why does that matter? Your spinal cord was meant to fit in a neck that had a C shape. When the neck structure gets pulled straight, it affects the nerve tissue, the spinal cord. It tractions the cord at the base of the skull, can affect brainstem function. And the brainstem is basically what controls every single function in your body. Muscle tone regulation, balance, thermoregulation, body temperature, blood pressure regulation, internal organ function. And so, if you're dealing with these types of chronic health issues and you're tired of having drugs thrown at you and you want to get to the root cause, one of the things that you can do is get to an upper cervical chiropractor who's trained at correcting the relationship of the head and the neck. And they do this through taking precise 3D imaging because everybody's out of place differently. Everybody's bone structure and joints are built at different angles. And by delivering the right force for you, your pattern of misalignment, and correcting the biomechanics of the neck and getting the pressure off the cord and allowing the soft tissue at the joint level to heal, mend, and repair, the body naturally can go back to how it should be. One of my favorite quotes, which kind of encapsulates what I just said, is nature needs no help, just no interference. So if you're someone dealing with all the things that I just mentioned, leave your story in the comments section below and we'll help you find someone who can get to the root cause and help your body heal back to how it should be.